Africa. What I'm hearing about respectful partnership says to me, we are not victims in Africa. We really have agency. And therefore, we ought to be able to say it very clearly and loudly exactly what it is that we would like to get out of the partnerships. We shouldn't just simply listen to someone telling us what it is that we're supposed to do. And I'll give an example. On the Act A globally, on GAP, which is the Global Action Plan for the US, which is run by the US, on the Financial Intermediary Fund, all of these are for pandemic preparedness. In all of these structures, Africans are not standing up as strongly as they should. They should be there at the table deciding what should be discussed, how it should be implemented. I'm not hearing that conversation here. I'm hearing a conversation that basically says they are doing something to us. What are we saying ourselves as Africans? I think that's very important. The second thing I want to say is that respectful partnership does not mean that if you have money, you can then decide on what exactly should be done. The person who receives the money is just as important as the one that is giving the money, especially when you talk about a pandemic, because you can put all the money out there and people refuse to vaccinate, for example, and we're all at risk. So the receiver of money is just as important as the one that is actually giving the money. Thirdly, I think we must actually respect each other as Africans vis-a-vis everybody else. Africa has got a lot of experience in dealing with communicable diseases compared to the North. And I can say very clearly because they don't have that experience of dealing with all of these diseases. But we do, because we live with them on a daily basis. And there is a tendency to ignore our knowledge in that respect. So I do think that it is critical that we should address that. The other thing I wanted to say is that when you start developing your own direction, you receive a lot of criticism. Africa decided that they wanted African Union, in particular with Africa CDC, as well as a commission that President Ramaphosa has set up. They've come up with a policy on a pandemic preparedness treaty, which is a treaty towards the African Pandemic Response Authority. They're establishing that. There's a lot of criticism to say, why is Africa going on its own? But Africa is unique in its background, in its situation, and therefore needs to be given the space to put together a proposal on the table for everyone else to be able to debate. And we're not given that opportunity. Immediately you start saying you want to do that, they begin to say no. And then finally we try to put together our own epidemic response fund. That is really where we can pool our resources so that we can be able to deal with the challenges that are facing Africa. Give us a space. Thank you.
Thank you very much, ladies and gentlemen, to Dr. Olive Shisana. I'm on the floor so that if there's anything interesting on the slide, or that our team can maybe put it up and we can lift that up as well. But Professor Shisana reminds us that Dr. Uzo said when he came up, he said, we need to reframe the conversation and start a new narrative. And what I'm hearing here is, have we accepted that we are naturally the character of the victim in every single one of these stories? And do we need to interrogate that character that Hades? Thank you very much, Dr. Leah, for being here with us. Minister of Health, the Honorable Minister of Health from the Federal Republic of Ethiopia. She's coming into this conversation with more than 20 years experience as a clinician, an academic, and an executive leader. And we're inviting the Honorable Minister to pause, share her reflections, what's resonating with her, what's top of mind in the conversation thus far. Over to you, Minister.
Thank you very much. Let's try it again.
Okay, thank you so much. It has been a very inspiring and exciting conversation since the morning, and I want to appreciate all the speakers, and also want to take this opportunity to acknowledge and appreciate the work and leadership of the Africa CDC in the past few years, especially within the pandemic. And I think Dr. Ahmed has put a lot of concrete things in the panel before. I think when we are talking on the new public health order, what we want in the way forward for our continent is very clear. The pillars have been put. We know there has been a lot of learning from the drawbacks or what is the missing points and where we want to go forward. And I think one of the key points I would like to emphasize, which has already been said, is how partnerships should really focus on countries' priorities. I think the global partnerships should really start focusing, should strengthen or revisit how they are looking at country priorities. Every country knows how to set their priorities, but those should be the foundations of where we all invest in. And I think Dr. Abubakar has said it very well earlier. And I think that has been one of the experiences we've had as a country for the past many years in terms of really focusing on every partner to come to the national priorities or strategic plans so that we have one plan. But it's not just about planning, it's about aligning our resources, our efforts, our implementation, and then it also goes to our reporting so that we have also a really aligned way of what we said is happening in those countries. And particularly when it comes to resources, there's a lot of fragmentation we see when we are looking at our own priorities. So it's not just in the best interest of the countries, but in the best interest of the donors and partners and collaborators to really work aligning in that plan, because it will bring more investment return in what we are looking at, because we need to look at sustainability. One of the key issues I think that was not well raised in the discussions is about sustainability. Are we looking to build sustainable health systems when we are supporting countries? Because short-term investments or investments that will only impact lives in the short term are important, but they should be aligned to long-term system development. So when we are talking about workforce, strong institutions, this is what we are talking about. But as much as what we are asking what our partners, donors should do, we need to also ask what we should do. And I think that's what Dr. Oliver tried to say, because when we are talking about country leadership, we cannot expect that to come from our donors. It should be us really leading it, driving it. So country-led partnerships for the benefits of the communities and vulnerable population is critical, but that requires strong leadership of us governments to take that lead role in terms of bringing everyone to the same plan, to the same priorities, so that it's bringing lasting impact. But one last thing I would like to say is what we are investing on should not really be affected by other factors other than the good intention, what's good for the people and the vulnerable communities. It should not be, if I may say, waxing and waning because of different situations, including political situations, because we are all working, especially when we are investing in health, we are working for the benefits of the vulnerable population. So I think that's also critical.
Ladies and gentlemen, a warm round of applause for Honourable Minister Teresa. Thank you very much. Thank you very much, Minister. And I think what the Minister has done is that she's begun to transition us into the next conversation, because we are wanting to interrogate the design principles of what a respectful and action-orientated new public health order would look like. And she's already begun to tell us that it has to be anchored in country priorities. There has to be an alignment of resources, alignment of implementation, alignment of reporting, and that it needs to be sustainable for the long term. So to build on this conversation, conversation. I'm going to welcome back Dr. Uzo, and this time in his storytelling extraordinary capacity, as he is now going to lead the next conversation that looks at those design recommendations. Let's give Dr. Uzo a round of applause as he comes up, please.
Hi. Okay, great. So it's me again. Hi, everybody. We have